Congressman Mike Boss.
Yeah.
So physicians generally tend to be decent people. Not everyone. But what I mean to say is this, that you need a certain heart in this game of healthcare. So people might argue the physician makes a good salary, they have a nice car, we have a good house, we're very privileged, don't worry about our problems. I'll beg to differ. I'm in the same space. So just like all of you are community leaders, you shape and mold a community. Roads are built based on your work. Children choose professions based on your work. People cultivate their philosophies of life based on your work. It's serious business. So that being said, the physician brings on average 15 jobs in a community. A physician gives a good amount in property taxes and state or federal taxes from his or her income. And a physician creates a fair economic surplus in his or her area, not to mention just goodwill, taking care of people, going that extra mile. I mean, I've had friends who drive a patient home because they don't have a ride. I've had colleagues pay for a patient's bill. You understand what I'm saying. It's a different kind of mentality. It's a different animal when you have to be a physician. So I'd like to ask you, as a friend and a professional, I've known you a long time, what's happening on your side? You have so much legislative responsibilities. You've seen it in your own family on the healthcare space. What is happening on the legislative front? Maybe to touch on this physician shortage or immigration or anything along this space.
It's actually, you've touched on about 2 or 3 things that, and I'm going to add on to a little bit that, more than that if I can. One, when we talk about the physician shortage, quite often the physician shortages in our area are caused by the fact that, one, affordable, the ability to afford the education, and then you've got to find a place that you can actually generate enough revenue, one, to pay for that education, and gives you the opportunity to raise your family, because yes, you're a servant to the people as a medical provider, but you're also like anybody else with a job. You want to provide something nice for your family, you want to be able to raise your children in a community that where you're loved, respected, they enjoy there. So what we have to do is there are several things that have hampered that over the years. One, as I said, is the cost of education. That being said, the state of Illinois, as well as the federal government, at times, and for the rural community, offers scholarships and or pay-fors that will benefit for your educational purposes if you return for a certain length of time to the local community. That's the idea and intent, because I believe that if you come to someplace like Southern Illinois, you stay for a little while, you're going to want to stay for a lifetime. But you have that. The other thing you have to do is you have to be, look, and I'm not going to speak for all the doctors in this room, but the ones that I've visited with and talked with, they have a passion to do what's right to make people healed, to heal people. But unfortunately, quite often, they have to worry about the business pressures that exist in a state, or a possibility of tort liability that's so heavy that you're afraid to move forward with some tough decisions for what's best for the patient. So these are the type of things we see. Now you put on top of that with what we're doing and how we're arguing right now, how and what is going to be the way that the Medicare or medical services are provided for. I do not disagree with when they move forward with the ACA wanting affordable, portable, and dealing with pre-existing conditions. The problem is it didn't do that, because what we had a bill that was so big and so overwritten, and then they wanted to pass it to find out what it did and what was in it. That's not the way we need to do things. We've got to come together, we've got to work together, and we've got to understand that Medicare for all is not the answer, because that'll lose the Medicare for the people that are receiving it, and the cost would be to the point that we could not afford it. So we've got to make sure the incentives and the competition is out there in medicine that encourages the best of the best to stay in medicine, and to encourage hospitals and give them the opportunity to keep their head above water in our rural communities. These are all perspectives we've got to look at and listen to the people and understand that just grabbing something out of the sky and saying, oh, but if we just had a single payer system, that will work. No. What we have to do is we have to come up with the ideas that are incentives for the doctors to do what they do to the best of their ability, to make it affordable, And how better can we make it affordable than we get the best of the best in the business itself?
Agreed, Mike. I very much resonate with many of your passions in this regard.